Thank you for choosing Broward Health Coral Springs Hospital's colorectal program. Our entire staff is committed to providing excellent care. It is normal to be a little apprehensive prior to your surgery, but we are here to educate you and make you feel as comfortable as possible. The day of surgery, when you arrive to the hospital, you will be taken to the pre-op holding area. You will see your surgeon one last time before surgery in the pre-op area. Following surgery, you will be taken to the PACU recovery room, where you may remain for 1 to 3 hours. During this time, pain control will be established using a patient-controlled analgesia pump, PCA. Our goal is to keep your pain at a manageable level. Upon your arrival to the inpatient unit, the nurse will get you settled. The nurse will give you a head-to-toe assessment, take your vital signs, and review your history, home medications, and the use of the incentive spirometry. You will have a Foley catheter, tube in your bladder to drain urine, in place for 2 to 4 days depending on the type of colorectal surgery you had. Activity is the main component in preventing pneumonia and blood clots. Our goal is to get you up and moving as soon as possible. For this reason, you will be getting out of bed to a chair the day of surgery, or at the very least, dangling your legs at the bedside. Each morning, you will have your blood drawn so the doctors can monitor your lab values. The day of surgery, you will begin a clear, liquid diet. Activity is important. The goal is to get you out of bed and walking at least 3 to 6 times that day, and throughout the hall 6 times daily before discharge. Staff members will help you when you get out of bed. Remember to ask for help when you need it. A nutritionist will see you in order to go over changes in your diet and instruct on recommendations of diet upon discharge. A case manager will evaluate you to see what type of assistance you will need upon discharge. If you have an ostomy, you should be visited by the certified wound ostomy continence nurse, who will begin to teach you how to take care of your ostomy along with your nurse. Once you tolerate your diet, you will be changed over to oral pain medications to manage your pain in preparation for discharge. If you are tolerating a low residue or regular diet, oral pain medicine, walking and urinating without difficulty, and support systems are in place at your home for your care, then you have met all the goals to be discharged. You will need a responsible person to drive you home, or the case manager can help arrange for your transportation. If you have any needs after discharge, they will already be set up by the case manager. Your nurse will go over the written discharge instructions with you before you leave. The instructions will include information on diet, activity, medications, incision care, and follow-up. If you have an ostomy, the CWOCN will visit you one last time to answer any final questions before you leave. You will also have home health set up for you by the case manager if indicated. Follow your discharge instructions given to you in the hospital. Take it easy when you arrive home. Do not expect to do everything you did before surgery. Full recovery can take up to 2 to 3 months. Avoid any strenuous exercises. Check with your doctor when you start an exercise program. Walking is the best exercise. Walk a little more each day. Minimally walk 6 times a day at 10-minute intervals. Do not lift anything heavier than a gallon of milk, about 5 pounds. Continue the use of your incentive spirometer and follow instructions given to you in the hospital. Drink plenty of fluids. Eat a well-balanced diet to prevent constipation. Do not take any laxatives unless instructed by your doctor. Do not insert anything in your rectum or ostomy. For example, enema, suppositories, or other objects unless instructed by your doctor. You may shower. Cleanse your incision with soap and water daily or as needed. Dry the incision with a clean towel. Report the following symptoms to your doctor immediately: fever more than 101.5 Fahrenheit, uncontrolled pain not relieved by prescribed pain medications, redness, swelling, or drainage at the incision site, increased output from your ostomy, unable to pass gas for 24 hours, prolonged nausea and vomiting. All of the staff here at Broward Health Colorectal Program wish you a speedy recovery.